Hi, my name is Farzana Hamid. I am a first year fellow in neonatology in Calgary. I would like to thank the organizer for giving us the opportunity to present our study. Our title is Effect of Blood Transfusion on Outcomes of Singleton Preterm Infants Less than 29 week gestation born small for gestation and appropriate for gestational age. The objective of the study is to determine the outcomes of SGA and AGA infants less than 29 week gestation who receive blood transfusion compared to infants who do not. This is a retrospective study conducted between 2015 and 2019 using CNN database. Inclusion criteria included singleton preterm infants less than 29-week gestation born small for gestation and appropriate for gestational age who did and did not receive blood transfusion. Moribund infants, major congenital anomalies, and large for gestation age infants were excluded from the study. Primary outcome was development of bronchopulmonary dysplasia, and secondary outcomes were death, retinopathy of prematurity, severe neurological injury, late onset sepsis, and necrotizing enterocolitis. Of 8540 infants born to Canadian NICUs, 3190 met the exclusion criteria. Out of 5350 participants, 3535 received blood transfusion, whereas 1815 did not. Table 1 shows maternal and neonatal characteristics. There was statistically significant difference when you compare the maternal factors such as diabetes, hypertension, antenatal steroid use, caesarean birth, and delayed cord clumping between non-BT and BT groups among AGA babies only. Neonatal factors such as gestational age and birth weight showed significant difference between non-BT and BT groups among AGA babies only. Babies with SNAP2 scores more than 20 and outborn babies showed significant difference between non-BT and BT groups in both AGA and SGA babies. Table 2 shows comparison of neonatal outcomes in AGA and SGA babies. Compared to infants who did not receive blood transfusion, adjusted ORs of BPD were higher in both AGA and SGA babies who received transfusion, and the ratio of two adjusted ORs also significant. The adjusted ORs of mortality was higher in AGA babies who received transfusion. The ratio of two adjusted ORs for mortality was not statistically significant. There was no significant difference in any of the other secondary outcomes between the two groups. In conclusion, compared to AGA infants who receive blood transfusion, SGA infants who receive blood transfusion are at higher odds of developing bronchopulmonary dysplasia. Mortality associated with blood transfusion in AGA and SGA babies needs further studies. Thank you.